Unmute ആയിട്ട് ഒരേ നിമിഷം.
Guys, we can start. Sudhir.
Start the history round. Alaka, are you there?
Yes, I'm there. Hello.
Okay, yeah. I believe we can start explaining the rules and
Yeah. Good evening, everybody. Congratulations firstly for getting selected for the final round. We'll start the final round with the history round. So move to the rules slide. Hello.
Surya, can we go to the rules slide, please?
Yeah. So the rules slide. The history round will comprise of 2 rounds, six questions in one round and another 6 questions in the next one. So pounds is open for all the questions. However, it is only for the picture slides. So this history round comprises of 2 slides. The first slide is only going to have a picture of the scientist, and the second slide is going to have clues about the scientists. So how this works is each team will get a direct question. And when you get a direct question, the first slide that is going to appear for all of you is going to be the picture of the scientist. Now, if you identify it directly with the picture, you are going to get your team 50 points. And there is not going to be a negative marking if you make a wrong guess. So after that, if at all you've not given the right answer to me, I'm going to move on to the next slide, which is going to display to you clues one by one. So for instance, if you answer the scientist by the first clue that I display, you will get 40 points. If you answer it in the second clue, 30 points, third clue, 20 points, and the last clue, 10 points. However, there is no negative marking to the direct team to whom the question is asked. There is no negative marking. But only one person can answer to each clue. You cannot have multiple answers for a displayed clue and then tell me to move on to the next clue. So it's only going to be one answer, and then eventually I will move on to the next clue. And then the pounds applies to this round. So the pounds will only be open for the picture slide of the scientist. There is no pounds for the clues that I'll display. So all teams are free to pounds, but the pounds has negative marking. So if you answer, it's plus 50. If you don't answer, you lose 25 points. And there is a slight correction. The pounds is only open for 20 seconds. It's not 40 seconds. It's 20 seconds. So, and the scientists are going to involve anything in the renal. It can be them having a discovery of the instrument. It can be them discovering a syndrome, an organ, or anything pertaining to renal field. So, any doubts about the rules? So if there's no doubt, can I move on to the round? Yeah, so this is a picture of the first scientist. Can we also have the timer?
Yeah, this is the question to team 1, right? Yeah.
Yeah, question to team 1. Please identify the scientist displayed.
Pounds is open. After the pounds closes, the team can answer. Pounds is open.
Yes.
Can we get the first clue, please?
No. This
Pounds.
this
Team 3.
is going.
Team 3 has.
Sorry, team 3.
Team 3 has pounds. Pounds time is over.
Oh. Okay.
Okay. So we'll wait for the direct team. Pounds closes.
Yeah. Okay. So team
Yeah.
1, do you have an answer?
Yeah. To answer, Albaran.
Okay, great. I'll give you full points for that. Great. So team 1 gets 50 points. What about the pounds team? Team 3?
Pounds team has answered correctly.
Okay.
Team 3 has answered correctly. Joaquin Alberan.
Yeah. Okay. If you, we could move on to the clue slide. Everybody can have a note as to what he's done. So he is a prominent French urologist in Paris, and he proposed a method of experimental polyuria to study the function of the kidneys. He invented the instrument for endoscopy of the lower urinary tract, and that is called the Alberan lever or the Alberan deflecting bridge. And then thereafter, there have been some eponymous for him, like there are something called Alberan glands, which are tiny submucosal glands near the prostate gland area. Then there is something called the Alberan sign, which is a sign of cancer in pelvis renalis. So shall we move on to the next question?
Yeah, 1 second. So for this question, team 1 and team 3 get
50 points. Yeah. So the question next goes to team 2. Please start the timer.
Pounds closes. Team 1 has pounced.
Okay, fine. Yeah, so can we have the answer from the direct team? Do you have an answer? Team 2?
We need clues.
Okay, let's move to the clue slide. So this is your first clue. He's a German scientist and is also an artist.
Next
In
clue.
fact, okay, fine. Move on to the next clue. He is referred to the man who put art into medicine. In fact, he was first known for his artistic talent, and thereafter he gained his knowledge in medicine and he discovered his findings.
Next clue.
Okay, the next clue. He introduced another method of nephropexy using a suture that he himself designed.
Next clue.
Okay, your last clue is he made a finding which constitutes an entry point to the calyceal system, and the avascular zone in the kidney is named after him.
Brutal. Avascular zone. Brutal's line is there.
Yes. I'll give you 10 points for this. So the scientist's name is Max Brodel. And so team 2 gets 10 points. What about team 1 who pounced?
Yeah, team 1 has pounced. They have got the wrong answer. They pounced Harvey Cushing. So they get minus 10.
Fine. Actually, Harvey Cushing is one of the people under whom Max Brodel gained his knowledge in medicine. But the answer is Max Brodel. Okay, so team 1 gets minus 25. Okay, team 1 minus 25, team 2 gets 10. All the other teams, they don't score anything. Can we move to the next question? Okay, let's move. Yeah, so the timer starts now.
Pounds closes. Nobody has pounced.
Okay, fine. Team 3, do we have an answer?
Can you give the clue, please?
Yeah, sure. So your first clue. Okay, so he was a professor emeritus in radiology at the New York University Langone School of Medicine.
Next clue.
Okay, your next clue. His finding is based on the imaging characteristics on contrast enhanced CECT. I'll give you another clue. It's a classification. So the classification is based on the findings that you see on CECT.
We are not getting.
Next clue, please.
Okay, the next clue. The 2F category to the classification was introduced later in 1993. So the original classification system did not have this 2F category, and it came only in 1993 by other scientists.
Can you please give the last clue?
Okay, the last clue. It is the classification system of renal cystic masses.
Bosniak only.
Bosniak classification.
Yeah, Bosniak classification. So the scientist's name is Morten A. Bosniak. I will give you 10 points. And what about the power? Okay, yeah, nobody has bounced. So, okay. So he was the first person to document the safety of partial nephrectomy for renal cell carcinoma, and also to describe how deadly a small renal neoplasm is. So he did a lot of work in visceral angiography, especially in urology. Can we move to the next team? Okay, so the timer starts now.
Okay.
Pounds closes. Nobody has pounced.
Okay, okay, fine. So team 4, can we have your answer if you have one?
Yeah, clue, please.
Okay, let's move to the clue slide. So she's a professor of neuroneurology actually at the National Hospital of Neurology and Neurosurgery of UCL.
Yeah, next clue, please.
Next clue. So this discovery of hers, it has contribution of 2 resources, but the syndrome that she's credited for has only her name. So yeah, the clue that you get from here is, she is responsible for a syndrome, named syndrome.
Okay. Sure, the next clue, please.
Next clue. So there was a proposal of relationship between the abnormal sphincter EMG activity and the observation that many of the women who had this syndrome had clinical features of a polycystic ovary.
Just a minute.
So basically, her research was based on EMG studies, and they found out that most of the women who had this syndrome also had features of a polycystic ovary.
Okay, next clue, please.
Next clue, the syndrome causes chronic urinary retention in young women due to poor relaxation of external urethral sphincter in the absence of neurological disease. So basically, there is no hysterical cause. This chronic urinary retention actually has a cause, which is because of the abnormal muscle action in the external urethral sphincter.
Steen-Leventhal syndrome.
Sorry?
Steen-Leventhal syndrome.
No. Do you want to give another try?
No, we'll We'll limit it to 1 tree.
Okay, fine. Okay. So the answer is Fowler syndrome. So you don't get any points. So the thing is that with her colleagues, she disproved that the symptoms were psychological or hysterical, because at that point of time, people thought the urinary retention was just psychological. And so she did a lot of study based on electrical stimulation therapy, sacral neuromodulation, and she came up with the syndrome. So she is Claire J. Fowler. So team 5, let's have the next question. Your timer starts now.
Pounce timer closes. Team 1 has pounced.
Okay, fine. So team 5, do we have an answer?
No, we want the clues.
Okay, fine. Let's go to the first clue. So he was born in Chicago and studied urology in the University of Iowa and worked under Dr. Alcock.
Next clue.
Sorry. Okay. Okay. Okay, so okay, there was a slight error. I'm really sorry. Can we move back? Can we move back to this clue? Can we go back? Okay. So okay. Please don't display the clues. I'll read it. Just don't display the clues. Okay. So the instrument that
We already saw the person.
Okay. Okay. I want.
Okay.
I want
Okay.
the full name to.
Yeah,
what do I
we
do?
need the full name. We need his full
Yeah,
name.
I need the full name. Otherwise, there's no point for this. I need the full name. Okay. So the second clue. Sorry.
Can you read out the clues?
Yeah. So the second clue is that the instrument that he invented is an advancement of the earlier version of the instrument, which was designed by a scientist named Bigelow.
Guys,
We don't know the full name. Elik, but we don't know the full name.
Okay, fine. Okay, then I'm not giving any points to this anyway. Whichever team counts, team 1, did they give the correct
wait.
answer?
Next clue.
They don't want the clue because they don't know the full name anyway.
Do you want the clue or not?
No, we don't.
They don't, like,
Okay,
you can display it, but they don't really want it.
Okay. So team 1 has pounced.
Yeah.
And they have typed Milo Elik.
Okay, yeah, that's the correct answer. So team 1 gets 50 points. So basically his invention was an evacuator which saves the transurethral surgeon from invaluable operating and anesthetic time, and it helps in EV surgery. So even though modern evacuators have come up, his device was very simple, and that is why he is well known for it even today. Can we have the next question, team 6?
Excuse me, weren't the other teams they just had to give the last name, right? I mean, I know there was an error in the
the problem was there was an error, and that is why I had to cancel it and ask for the
but for that the entire name, I mean, for most of them, like Bosniak, for most of the either they didn't have to give the entire name. I mean,
Yeah, that
just
was
asking.
because the clues earlier did not reveal his name. This slide accidentally revealed his name. So I'm sorry, but I can't help this. I can't give you points for this.
An alternate question, maybe.
An alternate question. Okay, we'll come back to this after the round is completed.
Yeah, sure. Thank you.
Okay. Yeah. So we'll move to team 6. Yeah, so the timer starts now.
We want a clue.
Just a minute. Is the pounce done?
Wait, pounce time is over.
Yeah. Has anyone pounced?
Team 3, team 2, team 3 and team 2 have pounced.
Okay, okay, fine. Okay. Okay, team 6, we'll have your first clue. So he is an American neurologist who is credited with the first description of a condition that comes under IgG4 related diseases.
Need the second clue as well.
Sorry? Next slide, next clue. Yeah. So 17 years later, he speculated correctly that the disease was systemic and was in the same group of diseases such as lupus, scleroderma, and periarteritis. So initially, he found out this condition, but he did not know much about it. But after researching for 17 years, he came up with the thing that the disease was a systemic condition.
Yeah, is it Ormond's disease? Ormond disease.
Yes. Do you know the full name?
Again, the full name. No one actually said the full name. That's the thing. We didn't, because it's IgG4 related and
Okay. Okay. No problem. I'll give you points for Ormond. So you'll get 30 points. Anyway, can we display the next clues also? So this condition, it presents with a lower back pain, kidney failure, hypertension, deep vein thrombosis, and other obstructive symptoms. So he basically described idiopathic retroperitoneal fibrosis. So his full name is John Kelso Ormond. He and Albaran, in fact, they both together have an eponym, which is known as the Albaran-Ormond syndrome, because even Albaran contributed a bit to this discovery of retroperitoneal fibrosis. Can we have the next question to team 1? What about the pounce teams? The team 2 and team 3, did they give the right answer?
Yeah, team 2 and team 3 both have written Ormond. Team 3 have written John Ormond. Team 2 has written just Ormond.
Okay, so team 2 and team 3 both get 50 points. Yeah, okay. So we'll move to the next question to team 1.
Pounce closes.
Okay.
Team 5 and team 2 have bounced.
Team 5 and team 2. Okay. Yeah. So team 1, do we have an answer from you?
Clue. We want the clue.
Okay. We'll move to the first clue. So he was a Swedish professor of anatomy at Karolinska Institute.
And next clue.
Okay. He was also an anthropologist whose studies of the human cranium led to the classifications dolichocephalic and brachycephalic.
Next clue.
He is credited with defining the cephalic index, which is the ratio of width to length of one's head, and he was also a polygemist.
Next clue.
Okay, the retropubic space is named after him.
Redzius.
Okay, yeah. So team 1 gets 10 points. What about team 2 and team 5?
Yeah, one
So
second.
his full name is
Team two have pounced as Retzius. Team 5
Okay.
has written as Bowman. So team 2
Okay,
gets
so
minus.
team 50 and team 5 gets minus 25. We'll move on to the next question to team 2. Your timer starts now, team 2, all the other teams.
Pounds closes. Team 1,
Okay.
team 3, team 1 and team 3 have bounced. Team 6
Team
has
1 and
written.
team 3. Okay.
Team 1 and 3 has bounced. Team 6 has written pounds. So
They have just written pounds.
they have just
Okay.
typed pounds. Team 1 and 3 have bounced.
Yeah.
Should
okay,
we
okay.
should we write the answer right now?
Yes.
Yeah, we have written
no,
the
no,
answer
no.
actually. We have written the
The
answer.
thing-
Actually, there is a network glitch here. Just a
No,
minute,
you
we are
have
resending
written
it.
pounds.
Yeah, we are having a network problem. Just we are sending it.
Okay, team 6 also has pounds.
Yeah, we have written. Yeah.
Okay, fine. So team 2, do we have an answer from you?
Yes. Whether it's Unterlich syndrome. Unterlich. He is the one who coined Unterlich syndrome.
Yeah, I'll give you 50 points for this. Anyway, can we have the clue slide also? So he's a German physician and a psychiatrist known for his measurement of the human body temperature. And the condition that he described was a rare complication of renal angiomyolipoma. It refers to the spontaneous renal or perinephric hemorrhage occurring in the absence of a known trauma. And the Lenz triad is the presentation which comprises of acute onset flank pain, flank mass, and hypovolemic shock. So team 2 gets 50 points. What about the 3 teams which counts? Praveen?
Team 1, team 3 and team 6 have also written Wunderlich.
Okay.
Julia, can you have the
Yeah.
PPT, please?
Yeah, it's being displayed. Team 3, are you ready? Team 3?
Yeah, we are ready.
Okay, fine. Can we have the the picture slide?
Hello, actually, one of our teammates isn't being allowed. If you don't mind, can you just do that, Janani?
Oh, can we move back?
Yeah, she's joined. Thank you.
Yeah. So team 3. Can we have the picture slide? Yeah, timer starts now for all the teams.
Time is up. Bounce time is up.
Okay.
Team 1 and team 6 have bounced.
Okay. Okay, fine. What about team 3? Do we have an answer from you?
Yeah. Vegat Meyer.
Yeah. Okay. Okay, fine. So team 3 gets 50 points. What about the bounce teams 1 and 6?
Team 1 and team 6 both have written Mayer and Vegat.
Okay. Okay, fine. So team 1 and team 6 all get 50 points. We'll move to the next question.
Team 2, everyone please switch on your video. Yeah, okay, fine.
Yeah. So the next question goes to team 4.
Yes.
Yeah, next clue, please.
Wait, bounce. Wait. Bounce time is over.
Okay.
Team 1, team 2, team 6 have bounced.
Team 1, team 2, and team 6. Okay.
Yes.
Okay. Team 4, do we have an answer from you?
Clue, please.
Okay. Your first clue, he's a South African physician graduating in medicine from the University of Edinburgh Medicine School.
Yeah, next clue, please.
Okay. Next clue, he spent 6 years in Egypt where he was appalled by the dishonesty, corruption, and neglect of poor patients, and he wrote a pamphlet calling for the reform of Egyptian medical facilities.
Next clue, please.
Okay, next clue. Beginning in 1875, doctors at London's St. Mary's Hospital had studied 16 patients in 16 people in 3 generations of the same family. Over the next 50 years, doctors described other families in which multiple family members in each generation had unusual symptoms, including nephritis, hematuria, the presence of albumin in urine, increased blood pressure, and death at a very young age.
Is it Alport?
Yes. Yes, the answer is Alport. The next clue is in March 1927, he published his findings in British Medical Journal, Alport syndrome. So team of 4 gets 20 points. What about the pounds teams?
Team 1, team 2, and team 6 have all written Alport. So
Okay. So all of them, team 1, team 2, and team 6, all of you get 50 points. Team 3 and team 5 doesn't get anything for this question. Okay. Next, we'll have the question to team 5. His full name is Cecil Alport. Yeah. Next question to team 5. Timer starts now.
Yeah, pounds time closes.
Okay.
Team 6, team 1 and team 2 have bounced.
Okay, okay, fine. Team 5, do we have an answer from you?
Clues, please.
Okay. Your first clue is he was a musician and a collector of Asian art and loyal supporter of his wife's engagement on behalf of contemporary art and cultural and feminist causes. He belongs to Hungary. So basically, his wife is famous for holding protests for the support of feminist issues. So he was a musician and he was a
Next
big
clue,
believer
please.
of his wife's cause. The next clue, he earned worldwide reputation in the fields of topographic and comparative anatomy as well as morphology.
Next.
Next clue, his name gives eponyms to bodies, convolutions, dehiscence, tubercles, and fascia.
Killian.
Sorry?
Killian.
No, that's the wrong answer. I'll move to the next clue. If you can find it out, you can give me the answer then. He discovered the posterior renal fascia, which gets its name from him.
Zucker candle.
Yes. So team 5 gets 10 points. The pounds teams, how much do they get?
Yeah, 1 second. Team 6, team 1 and team 2 all have written Zucker candle.
Okay, great. So team 1, team 2 and team 6. You all get 50 points for this question. Okay, we'll come to the last question of the round to team 6. Can we have the picture slide? Yeah, your timer starts now.
Pounds time is over.
First clue.
Pounds time is over.
Okay.
Team 3 has pounced after the pounds time.
Okay, we are not going to include team 3 in this. Any other team has pounced?
No, no other team has pounced.
Okay, okay, fine. Team 6, do we have an answer?
We need a clue.
Okay, your first clue, he's a Swiss American pediatrician who made his discovery by studying siblings. So this gives you a clue that his discovery is a condition.
Need a second.
Okay, next clue, the condition is related to an organelle defect.
बार सिंड्रोम लग रहा है मेरे को और कुछ है ये क्लू लूं क्लू ले लूं यार रिस्क लेते हैं ना मैं जा रहा हूं यार बार सिंड्रोम के साथ क्लू
Okay, I can still remind you that there is no negative marking. So if you still want to guess it with the second clue, you can try. But you only have one guess and then I'll move to the next clue.
We have a doubt. Suppose we answer wrong
on second clue.
So do we get a chance in the third clue?
No.
I mean, we're coming to the last question, but yeah, I mean, I announced it in the rules that to the direct team, if at all, even if you give me a wrong answer, but I can only let you give me one guess for the condition and I can move on to the next clue.
No, we go for the next clue.
Okay, fine. We'll move to the next clue. It is due to the absence of peroxisomes in hepatocytes and
Correct.
renal tubular epithelial cells, and helped in the discovery of
Zellweger-
other conditions.
Zellweger
Sorry?
है ना? Zellweger syndrome.
Yes. Yeah. So the answer is Hans Zellweger. You answered it to me in the third clue, so I'll give you 20 points. So we come to the end of this round. Considering the discrepancy that we had in question number 5, I need some time. I'll come up with another question. So for question number 5, team 1 had gotten 50 points for pounds. That gets nullified too. So after the second round, I will come up with another question which will be open to all the teams, and it will be a direct question. to
We
team five.
pounced. We did not see the clue, and we answered the full name also.
Fine.
So, like, why are we getting nullified?
Yeah,
No,
you
no.
did,
The
but then
whole question is cancelled. The whole
Yeah,
question is cancelled.
exactly.
Another new question will be there. For that, you can
Yeah.
bounce.
right.
Can you tell which teams had pounced for that question that just got cancelled?
Only team
Only
one
the
has
first
bounced.
team.
No, team 1 and team 2 had pounced. Yeah, which question are we talking about? It is the
Question number 5, the ELIC question that was accidentally displayed. I mean,
okay. The
according to my
accidentally displaced
scores,
question. Yeah, only one team won.
Only
Only
question,
team 1 has
only
pounced.
team
Yeah.
1 has pounced.
Yeah. So we'll cancel off that question. I will come up with another question by the end of second round, and everybody will get a fair chance for that. Meanwhile, just give us a while. We'll get back to you with the scores of this round.
Has any team pounced for the last question, the 12th question?
No team
No,
has
no
pounced
team
for
has
the last question.
Yeah, okay. We'll proceed to the next round.
Yeah, the scores are ready. Shall I reveal the scores?
We let's not reveal the scores now. We'll keep the last, like the 5th question again, and then we'll reveal the scores for the first round.
Yeah, okay.
Yeah, okay. Yeah. Thank you, everybody. Wishing you all the best for the next rounds.
Thank you, Alika. For the wonderful room. Today, can we know how much time is left there in this meeting?
$18, sir.
Yes, we'll
18 minutes is left.
we'll get on to the next one. Rishabh, are you there?
Yeah, I'm audible. Am I audible? Hello.
Yes, you're audible, Rishabh. Audible.
Yeah, we are audible. We can go to the next round.
Good evening, everyone. Good evening, everyone. Now, this is the second round. It's a case diagnosis round. Coming to the rules of this round. There is a slight change in the marking system. So there will be 6 hyperlinks, and each team will have to select one hyperlink, and that will lead to a question. It's a case question. So after the question has been read, timer will start. The timer will be for 60 seconds, of which the first 20 seconds is for pounds, and the remaining 40 seconds that particular team can answer. And if the team to which the question is directed, if they answer it correctly, they will get 40 marks, and there is no negative points for that team. For the pounds, if they answer it correctly, we will get plus 40. And if you answer it wrong, you will get negative, you will get minus 20 points. Is that clear? If there is no doubts, I'll continue with the.
Yeah, we can. I think we can go on.
We have to answer after the pounds time is over, right?
Yeah, similar to the previous time. You will go from team 1 or team 6?
Team 1, team 1. We'll go from team 1.
Team 1, please select one.
Iron Man.
Here is a question. A 14-year-old boy presented complaints of pain in his right leg for 9 months and contractures of the right leg, which has developed over this period. There is no history of significant trauma. Born 3 weeks premature with bilateral renal hypoplasia and a seizure disorder, and attempts of renal transplantation has failed, so he is currently on peritoneal dialysis. Stunted growth and development delays during childhood include short stature, standing at 16 months and walking at 2 years. He sustained a right tibia and fibula fracture 6 years prior to presentation after minimal trauma. On physical examination, there is presence of poor dentition, right knee 15-degree flexion contracture, painful range of motion of right hip and knee. Radiological evaluation revealed osteopenia, subcortical resorption, loosened metaphyseal bands, and widening of metaphyses. Laboratory evaluation revealed serum calcium levels of 9.6 mg per deciliter, serum phosphorus levels of 6 mg per deciliter, alkaline phosphatase levels of 1047 international units per ml, and parathormone levels of 1800 picograms per ml. Now the pounds is open. Time has. Was the answer displayed, I think?
Hello, the answer was shown. Do you still want us to answer, or the other team needs to come?
You
No,
go
we will
back.
go
We
for
have a
another
spare
question.
for this. Go back. Go back to the hyperlink.
Team 1, please select another hyperlink.
Thor.
This is a question. 62-year-old female was referred to the nephrology unit for asymptomatic urinary abnormalities, including microscopic hematuria and proteinuria, which had persisted for a year. The patient also complained of generalized weakness and mild dyspnea during exercise. 2 years earlier, the patient had mitral valve repair surgery for MR. During the current visit, the patient had a blood pressure of 120/80 mm Hg, pulse rate of 65 minutes, 65 respiration rate of 22 per minute, and body temperature of 36.5 degrees Celsius. She has no significant complaints, past medical history other than hypothyroidism, and she has no episodes of gross hematuria. Physical examination revealed conjunctival pallor, but no evidence of jaundice, and there is no evidence of organomegaly and edema. Chest auscultation revealed holosystolic murmur in the mitral region. Next slide, please. Peripheral blood examination showed WBC count of 4,300 per microliter, hemoglobin level of 8.9 gram per deciliter, and platelet count of 227,000 per microliter. Serum biochemistry level show blood urea nitrogen level of 24.1 milligram per deciliter, creatinine of 0.8 milligram per deciliter, estimated GFR rate of 79 ml per minute per 1.73 meters square, AST of 55 international units per liter, ALT 16 international units per liter, total protein 6.8 gram per deciliter, serum albumin 4.3 gram per deciliter, and CRP 0.6 milligram per deciliter. Urine examination showed hematuria and proteinuria. Next slide. Chest X-ray and renal USG normal. Peripheral blood smear showed normocytic normochromic anemia with schistocytes and spherocytes. Paroxysmal nocturnal hemoglobinuria excluded by flow cytometry. Renal biopsy done and the diagnosis was made. The picture of renal biopsy is shown in the next slide. Now, what is the diagnosis? Timer starts for the pounds.
Can you go one slide behind?
Pounds time is over. Pounds time is over.
Can you go to the previous slide? Previous slide.
Pounds time is over. Team 4 has pounced. Only team 4 has pounced.
Now, team 1, do you have an answer?
Yeah. SLE related lupus nephritis, membranous nephritis.
No.
SLE causing membranous nephritis.
No, you're wrong. What did the Pounds team answer?
Pounds team has answered renal hemosiderosis.
Yeah,
Renal
that's the correct.
hemosiderosis.
Yeah, it's renal hemosiderosis. Which team has answered this?
Team 4. Team 4 has answered renal hemosiderosis.
Now, team 4 will get 40 points.
Excuse me, 1 minute. We got disconnected in call. Like 1 minute, can you give? We can reconnect.
Yeah, reconnect.
Wasn't it was plus 20 and minus 10 for pounds? How did they,
No, we had announced earlier it is plus 40 and minus 20. While reading the rule slide, we have clearly announced it is plus 40 and minus 20.
Okay, we are ready.
Renal hemosiderosis, that patient presented with history of prosthetic valve induced hemolysis, and in biopsy you can see the Russian blue stain for hemosiderin deposition. Now team 2, you can select a hyperlink.
Captain Marvel.
Here is a question. 33-year-old female presented with a history of bilateral intermittent flap discomfort for 6 months associated with mild burning irritation. Besides these complaints, she had a history of frequent episodes of migraine for which she used to take NSAIDs. There is no significant past medical history. There is no history of drugs and toxin exposure. Her father had history of diabetes and ischemic heart disease and end-stage renal disease, and he was on hemodialysis. On examination, her blood pressure was 160/90 mmHg, pulse rate of 88 per minute, and she was afebrile. Systemic examination unremarkable. Serum creatinine and GFR rate are shown. Next slide, please. Her urine protein examination showed proteinuria. Hemoglobin, total leukocyte count, and platelets are normal. Serological markers were negative. Abdominal ultrasound showed bilateral small size kidneys. Otherwise, it was normal. Her renal biopsy showed 60% sclerosis glomerulus. Predominant lesions include patchy but severe interstitial fibrosis, tubular atrophy, and arterioloclerosis. Remarkably, numerous tubular cells in the cortex and medulla showed nuclear enlargement with irregular outlines, hyperchromatic and prominent nucleolus. Immunostains for CMV and BK virus were negative. Next slide, please. And this is a biopsy picture. Now the timer starts for the pounds.
Pounds closes. Team 5 has pounced. Only team 5 has pounced.
Team 2.
Okay, NSAID induced nephropathy causing CKD.
Sorry, it's wrong. What did team 5 answer?
They have answered cariomegalic interstitial nephritis.
Yeah, that's a correct answer. Please go to the previous. A biopsy showed features of cariomegaly like hyperchromatic nucleus and
Everyone, please switch on your videos. I think all have joined. We can start.
Team 3, now it's your turn to select a hyperlink.
Spider-Man.
Now, this is a question. A 28-year-old man was admitted following a car accident and fracture of right hip and pelvic and orthopedic surgery was done 7 days before. He had not had any medical or drug history before the accident. His urine output decreased gradually and serum creatinine increased. His blood pressure and temperature is given. He was tachypneic, but the lungs and heart sounds were otherwise normal. Urine secretion in the surgery region was seen. Serum creatinine, blood urea, nitrogen levels, and all the laboratory reports are given. His urine microscopy showed isomorphic erythrocytes and leukocytes for hyperfield, 2 granular cast and leukocyte clamp. Urine analysis revealed proteinuria and hematuria and a pH of 4.5. Next slide, please. Ultrasound guided renal biopsy was done, which showed thinning of basement membrane without any glomerular hypercellularity, necrosis of crescent formation. The interstitium showed significant fibrosis and chronic inflammation. Some tubules contain cell of debris and revealed epithelial injury and atrophic changes. There was extensive focus of microcalcification. These calcified areas were positive in von Cosa staining and revealed no birefringence and a polarized site. The vessels were unremarkable. Now, what is the diagnosis? Timer stands for the Pounds patient. Previous slide for lab values. Surya, please change the field.
Bounce time is over. Team 6 and team 4 have bounced.
Now, team 3.
Thin GBM disease.
No, it's wrong answer. Team 4 and team 6, what did they answer?
Team 6 has written rhabdomyolysis induced pre-renal AKI. Team 4 has written acute phosphate nephropathy. So,
yeah,
I think
both are correct. It's basically a crush injury causing elevation of phosphate levels, and there was calcium phosphate deposition seen in the renal biopsy. Now, please go to the hyperlink.
so. Team 6 and 4 get 40 marks. 40 points.
Team 4, please select an hyperlink.
Yeah, Captain America. Hello, Captain America.
Here is a patient. 50-year-old male from Romania came with complaints of weakness, fatigue, and copper brown discoloration of the palms and soles. His father had similar complaints and he was diagnosed to have a variant of renal tumor. No significant past medical history. On examination, pallor is present and there is mild lumbar tenderness. He is afebrile and has a pulse rate of 83 beats per minute and blood pressure of 140 by 90 mm Hg. Urine analysis revealed proteinuria. Urinary sediment showed sparse RBCs and WBCs. Serum creatinine and EGFR rate is given. His serological workup was negative. What is the diagnosis? Timer starts for the pounds question.
Pounds timer closes. Team 3 has pounced. Only team 3 has pounced. Pounds timer closes.
Team 3 has pounced. Now team 4, do you have an answer?
Team 4, time is up. Do you have an answer?
Yeah, Gotthardt Dubé syndrome.
Sorry, it's wrong. Team 3, what did they answer?
Team 3 answered Balkan nephropathy.
Yeah, that's the correct answer. Please go to the hyperlink. The answer is Balkan's endemic nephropathy. Team 5, please select an hyperlink.
What are the remaining? Hello? Which ones are remaining?
Hulk is remaining. Hulk.
Hulk, huh? Then we'll go for Hulk. Hulk.
Here is the question. 45-year-old woman with history of diabetes mellitus, hypertension, and end-stage renal disease on hemodialysis for 6 months, presented with complaints of multiple plaques on her extremities, which started on her left leg and progressed to involve her hands, and the plaques were tender and non-pruritic. Physical examination revealed multiple symmetric, large and hyperpigmented edematous and indurated plaques on her hands, legs, ankles, and foot with a characteristic UD orange appearance. Next slide. Joint examination showed normal range of motion without signs of arthritis or muscle contraction. History of gadolinium-based contrast imaging was not there. Family history was unknown. 2 skin biopsies were performed. It showed increased dermal fibrosis and sclerosis involving the dermis, septa of subcutis and fascia, increased dermal spindle cells, fibroblast proliferation extending to subcutaneous tissues, and there was increase in dermal mucin. Next slide, please. Here is a picture of patient and the histology report. Now, what is the diagnosis? Timer opens for the pounds.
Pounds timer closes. Pounds timer closes. Team 6, Team 3, and Team 1 have pounced.
Can you show the previous slides if you don't mind? The one before this?
Time is up. I think they should
Team
answer.
5.
Negative, right? There's no negative, right?
Sorry.
No negatives. You are the direct team.
Nephrogenic systemic fibrosis.
Yeah, that's the correct answer. Team 1, Team 3, and Team 6, what did they answer?
Team 6 has answered scleromyxedema. Team 3 has answered necrobiosis lipoidica diabeticorum. Team 1 mycosis fungoides. So I don't think.
Team 1, Team 3, and Team 6 gets negative points of 20. Team 5 gets 40 points. Now we can. The answer is nephrogenic fibrosing dermopathy. Now we can go to the hyperlinks. Hyperlinks.
What is left?
Team 6.
I guess all are done. What else is left?
I think we should go for the spare. Just wait a second. Wait a second. Yeah, go to the just go to the end of this round. Just go to after question number 6. Just go through the slide. Wait. Don't scroll. Slowly. Just in the slideshow itself, go to the end of this round. Yeah, slowly. Yeah, I think stop. From around 75th slide, you go for slideshow. 75th slide, go for slideshow. Yeah, now, yeah, just go to the. Yeah, next. I think this is the question. Yeah, this is the question for team number
Team
6.
Team 6, I will read out the question. 73-year-old female with a past medical history of hypertension and end-stage renal disease on hemodialysis is sent from nursing home for evaluation of hyperkalemia. The patient did not undergo hemodialysis for past 3 weeks because of malfunctioning AV fistula. On presentation, the patient's potassium was elevated with no ECG changes. The patient's urea and creatinine level are given. The patient was given potassium binders, insulin, and dextrose, and plans were made to attain access for hemodialysis. And once the hemodialysis was, but the creatinine level was, creatinine and urea level was given. Immediately after hemodialysis, the patient was found to be confused and disoriented. Patient's blood pressure, heart rate, and saturation were within normal limits. And the patient had witnessed a generalized tonic-clonic seizure, which had lasted 30 minutes and itself terminated by itself. CT showed features of transient cerebral edema. Blood glucose, electrolytes, and renal function was normal. Blood and urine cultures were negative. Analysis of patients. What is it?
It showed analysis of patients' post hemodialysis status showed dramatic drop of blood urea nitrogen from 229 to 106.
What is the diagnosis?
The last line. Analysis of the patient's what?
There was a rapid drop in blood urea nitrogen level.
Pounds time is over. Pounds time is over. Team 1 and 2 have pounds.
Can we answer? Is it dialysis disequilibrium syndrome?
Yeah, that's a correct answer. You get 40 points. Teams 1 and 2.
They have also written dialysis disequilibrium syndrome. They also get 40.
Now this is the end of this round. The scores we will say it in a few minutes. Thank you.
Hello, can you let my teammate in the chat, Saumitra?
Yeah, what happened?
He's trying to get into the Zoom. Admit him, admit.
We'll have the question from the history round now, and we'll have the scores later after the question.
This will be the direct question for team number 5, the history round.
Just one second, let my teammate come.
Yeah.
Can you please let our teammate in? He's still getting a message that the admin needs to admit the in meeting. Yeah.
हो गया, full हो गया.
Yeah. Okay. Thank you.
अरे unmute कर दो, Saumitra, unmute करो.
That's it, right? Everyone has joined, right?
Yes, yes.
Yeah, Alka, we can proceed with the question.
Yeah, okay. So the fifth question that we had cancelled, we are doing it now. So the direct question is to team 5. All other teams can pounce for 20 seconds. Also, only the picture slide is going to be displayed. I'm going to read out the clues. If at all I'm not clear, please ask me to repeat it. All the scoring points, everything is same. Can we have the picture for team 5? Team 5, are you ready?
Yes.
Yeah, so this is the picture. The timer starts now.
Time up. Pounds time is up.
Okay.
Nobody has pounced. Pounds time is up. Team 5 can.
Okay. Okay, fine.
We'll
Team
go for the
5,
clues.
do we have an... Okay. Okay, so your first clue is the contribution that he has made it with another colleague of his. But I only want the name of this scientist that I have displayed on the phone. So here, he is an Austrian-born American pediatrician, and his name is what I'm looking for.
Next clue, please.
Okay, the condition that he and his colleague discovered, it was popularized by the second scientist who was a German geneticist.
Next clue.
Your third clue, the features of this condition, they have distinct craniofacial phenotype and intellectual disability associated with urinary malformation, hypospadias, and cryptorchidism.
Yeah.
If you give me the name of the condition also without knowing which particular scientist I'm talking about, I'll give it to you.
Next clue.
Okay, your last clue is it is a condition caused by, it is a microdeletion syndrome, which is caused by deletion within the HSA band of the short arm of chromosome 4. Your last clue, it's a microdeletion syndrome, which is caused by deletion within the HSA band of the short arm of chromosome 4.
We don't have an answer.
Okay, fine. So the answer is Wolff-Hirschhorn syndrome. So the scientist that you're looking at, he's Kurt Hirschhorn, and his partner was Ulrich Wolff, who found out this condition and gave it the name of Wolff-Hirschhorn syndrome. Yeah, okay, thank you. So nobody scored anything for this round. I mean, this question.
Yeah, we'll go for the scores at the end of two
Yeah,
rounds.
we'll go for the scores.
We'll have the scores now. At the end of the first round, the teams were as follows. Team 1, 235. Team 2, 260. Team 3, 210. Team 4 at plus 20. Team 5 at minus 15. And Team 6 at 250. With the addition of the scores from round 2, the scores are as follows. Team 1 is at 255. Team 2 is at 300. Team 3 is at 230. Team 4 is at plus 100. Team 5 is at plus 65. And Team 6 is leading the quiz with 310 points.
Fine, we'll go for the next round.
Hello. Hello. One of my teammates, can you let him in? मैंने कुछ जर्नी भी की है ना ज्वाइन कर वहाँ से लीव करो ना मेरा चार्जर दे दो वहाँ से
Hello, am I audible?
Yeah, you are audible.
Okay, everyone is ready. Is everyone ready?
Yeah, everyone is there. I think we can start.
Wait,
okay.
Can
Yeah,
you
what happened?
in as well? Saumitra, Team 6. We actually changed device because of discharge.
Now Team 6, you are ready? Team 6, are you
Team
ready?
6?
No, we are not ready yet. Please wait.
Yeah, okay.
Please admit my teammate. He is trying to join with the name Soumya Tathagat Bera, Team 6.
Guys?
We are ready.
Yeah, they are ready. I think we can start.
Okay, I will be conducting drugs and diagnostics round. This round consists of 12 questions. There will be sets of questions which will be displayed in the hyperlink. There will be 6 sets of questions. Each set will consist of 2 questions, one based on a drug and another based on a diagnostic modality. Each question will carry 40 marks. The answering team will not have any negatives. The team answering on pounds for each question will have a plus 40, and for the team answering negative wrongly in the pounds question will get minus 20. Is it okay?
So this is
Can we
also
bounce
plus.
for individual questions? Like there are 2 questions in each set, right? So are we allowed to bounce for a partial question?
Yeah, each question pounds will be there.
We have plus 20, minus 10 for each part of the set, right?
No. Each question will have 40 marks. I mean 40 points. And the answering team will not have any negatives.
Okay, so a set carries 80.
So total
then.
points is 80. 80.
Okay, fine. Yeah. Thank you.
So each question will have 30 seconds. Duration will be 30 seconds. The team answering on pounds will have 20 seconds.
If he answer one correct in pounds and one incorrect,
then there'll be 40 minus 20. So you'll get only 20. Is it okay?
So there is plus 40 minus 20 for every part, right?
Yes. Each question will have, if you answer correctly, you'll get 40. Otherwise, negative, minus 20.
Will both the questions be displayed simultaneously?
No, one after the other only. If you answer the first question only, then you'll present the next question.
Okay.
Excuse me. If on pounds we get one answer correct and one wrong, we get 0 points, plus 10 and minus 10.
No, it's 40.
No,
each question right answer will get 40.
Is it compulsory to pounce on both questions, or can we just pounce one
it's
and
your
leave
choice
other?
only. It's your choice only to pounce or not.
For each set, each question, the pounds will open. For each question, it is plus 40 minus 20 for the pounds, and for the direct team, it is plus 40 0. So all teams can score a total of 80 points in one set. That is clear.
Is it okay?
Yeah, fine.
Okay, can we go to the hyperlinks? Next slide.
Team 6, Soumya,
can we start from
turn
team
your
1?
video on?
Which order should we follow? Team 1 or team 6? Hello?
It doesn't matter
we-
because
Team
it's
one
hyperlink.
from team one. From
Which
team
team
one.
are we going?
Okay. Team
Team
1,
one?
you're open to choose any hyperlink.
Okay, Daenerys.
Okay. Surya, please press on Daenerys. Click on Daenerys. The first question on your drug. It is a phosphate binder indicated for control of serum phosphate levels in adult patients with CKD on dialysis. It lowers serum phosphate levels by decreasing the absorption from the GIT. Based on its mechanism, it can be effective in lowering serum phosphorus in pediatric patients also with CKD. So it will decrease at seconds hyperphosphatemia. It was approved on 2013. Which is that drug?
Yeah, Pounds
Team one.
opens. Wait. Pounds opens for this question.
Pounds open.
Pounds closes.
Team 1. Do you have an answer?
Wait.
Yeah.
Team 6. 1 second. Team 6, Team 5, Team 4, Team 2 have bounced. Okay.
Can we answer? Hello.
Okay, you can answer. What is the drug?
Sevelamer drug.
Sevelamer.
No. Sevelamer is
no.
not. Sevelamer is not the answer.
Okay. Can we go to the next question? Next slide. Diagnostic question. Yeah, team 1. Question is for you, and Pounds is open for other teams. Team.
Pounds is open, guys. Okay, 20 seconds are over. No one has bounced. The direct team can answer.
The investigation is phase contrast microscopy, cell is decoy cell, etiology is BK virus.
Yeah, you have said the investigation is correct. Your named cell is also correct, but
etiology is also correct. Etiology is also correct.
Correct. Okay, etiology is also correct. So next slide, please. Answer slide. The drug mentioned was sucroferric oxychloride. The diagnostic modality is phase contrast microscopy. Etiological agent is CMV, or you can say BK virus.
So for Pounds, for the first question, Team 2 and Team 4 get it right. Team 6 and Team 5 get it wrong. And then for the second question, nobody has bounced. That's it. And the direct team has said the second question correct. The first question is wrong.
Master, can you just split the points for the teams respectively?
Yeah, Team
Like,
2
can you
and
announce
team,
the points?
Yeah, Team 2 and Team 4 get 40 points.
I hope all the participants are here. Okay. So the thing is, we are going to keep a pause on the drugs and diagnostics round. We'll move on to rapid fire, and then we'll come back to drugs and diagnostics. We stopped with the third question.
Yeah, okay. So we are going to do rapid fire now. So I'll share the screen.
So the first question is again cancelled.
Sorry?
No, the first question is again cancelled. Then drugs and
No.
diagnostics.
That first question is there. First question is there. No problem with the first question.
No. Yeah. Those points. Yeah. And then we'll come back to drug and diagnostics.
Am I audible? So the hello.
Is the screen visible?
Yes.
Yes,
Am
it is
I
visible.
audible? Am I audible?
Can you speak a little bit louder?
Am I audible?
Yeah, you're audible.
Okay. We are conducting rapid fire round now. Okay, next, move to the next slide. Rules slide. Praveen,
Yeah. One second.
okay.
Rules lead.
Can you hear me now?
Yeah, you're audible.
Okay. Here are the rules. Each set has 10 questions. Each carries 10 marks. Okay. You can choose which was, and total duration is 75 seconds. You have to answer within 75 seconds. That is 1 minute 15 seconds. The first answered one is taken into consideration. Okay. Rules are clear, right?
Yeah, fine. You can
Okay. Move to the next slide. Hyperlink slide.
Is it moving or?
No.
No, it's
in the
not
same
moving.
slide. Still in rules.
Yeah.
Okay. Okay, I'll start with team 1 or like team
Team
6.
1.
Okay, team 1.
Can we start with another team?
Which one are you choosing?
Why are you starting with team 1 only always?
I mean, it's hyperlink, okay. So, okay, we'll start with team 6 now.
Okay, we'll start with team 6. Team 6, which hyperlink do you want to choose?
First, can you allow our teammate to join?
Pardon?
Can you allow
Pardon? Okay.
What's the issue? I'm sorry.
Have they joined? Have they joined?
Yeah.
Okay. Which one you want to choose?
Insta, Netflix, yeah.
Netflix.
Instagram.
Okay, Instagram.
What? Instagram.
Instagram.
Yeah. The time starts now.
One is Alice Catenin. 10 is false. 9 is PGN. 9 is MPGN. 7 MCU, mixed-rated cystoretrogram. Hello.
MPG.
Let them answer. Answer. Keep answering.
You answered one. Next.
Alice Catenin.
Keep answering.
2 is skipped. Serum chloride and concentration is hello. 6 is true.
Hello. Okay.
96 to 106 milliequivalent per liter is the serum chloride concentration. और क्या tag है? हाँ, वाटर से और दो और क्या बचे? क्वेश्चन एट बचे दो बोन का 8 नंबर बचे.
Hello.
Yeah. 8 बचे, 3 बचे और 2 बचे. हाँ, dynamic bond.
Okay, time's up. Hello.
Hello.
Can you hear me right?
Yeah, we can.
You
can
answered first one, fourth one, fifth one, sixth one, and ninth one.
Seventh one as well. We said
4,
MCU.
5.
Ninth
Okay.
and 10th also. We said 9th and 10th as well.
Yeah, you answered ninth. Okay.
We said 9th as MPG and 10th was false.
10th false. You answered.
Yes.
10th you answered. Hello.
Yeah. Can hear you.
You answered.
Shall I go to the answer slide? Yeah.
5th, 6th, 7th, 9th, and 10th, right?
Yes. We answered 8 as
Answer
well.
slide.
A dynamic bone disease. Just before the time ended, we said A dynamic bone disease.
But I didn't hear that one.
That is not a fault. I guess Praveen had heard it.
No. I don't think anyone heard aerodynamic bone disease, but the others, I think we heard.
Yeah.
Yeah. We had answered a dynamic bone disease. Yeah.
Okay, I'll give it
Just
to you.
before you say time off.
Okay. First one, direct renin inhibitor aliskiren is right. Second one is allantoic diverticulum. Third one is polypoid cystitis. Fourth one you said right. 96 to 106 milliequivalents per liter. Fourth one is Gentleman syndrome. Sixth one is true. You said right. Seventh one is contrast MCU. You said right. Eighth one is adynamic bone disease. You said right. Ninth one is also right. MPGN. 10th one is also correct. False. You answer 1, 2, 3, 4, 5, 6, 7, 8. 8 questions correct. 80 marks for team 6. 80 marks for team 6.
Fifth question, they told Bartter syndrome, not Gentleman syndrome.
Yeah, fifth one they told Bartter syndrome only.
Okay. 70 marks. 70.
Negative is not there for wrong answer, sir.
Oh, no negatives. But if you answered wrong is 0. You will get 0 marks. Okay. Team 5, choose one hyperlink. Team 5.
Just a second. We're having a little connection problem. Just checking if it's fine. Just 1 minute.
Can you move ahead with team 4 in the meantime, please?
Okay. Team 4.
No. Actually, no. It's fine. We'll go for it. YouTube.
Okay. YouTube. Okay. YouTube. Your time starts now. What is the drug used in treatment of refractory?
Second one is the inferior mesenteric artery. Second one is inferior mesenteric artery. Third is interstitial cystitis, bladder syndrome.
Okay.
Chloride channel dense disease.
Okay.
Type of FSGS and HIV is collapsing glomerulonephropathy.
Okay.
அடுத்ததா சொல்லுங்க. Sandy patches, schistosoma hepatobium.
Okay.
Refractory edema, single hepatic cirrhosis. என்னது? True or false? அதெல்லாம் சொல்லியாச்சுமா. 10 ஏதாவது சொல்லு. Prostaglandins. 10 true, 10 true.
Okay. Okay, time's up. You answered second, third, fifth, seventh, ninth, and 10th question. Move to the answer slide, Praveen. So, the first answer is spironolactone. Second one is inferior mesenteric artery. You said right. Third one is interstitial cystitis. Third one is right. Fourth one, we gave ammonia buffer system is 9.2. Fifth one is dense disease. You said correct. Sixth one is false. You didn't answer. Seventh one, schistosoma hematobium. You said right. Eighth one is grade 3. Ninth one is collapsing nephropathy. You said correct. 10th one is true. You said correct. You answered 1, 2, 3, 4, 5, 6 questions, 60 marks. Okay. Team, move to the hyperlink slide. Ravi. Team 4. What set you want to choose?
Spotify.
Spotify. Okay. Your time starts now.
Second one, Brodels.
Okay.
Simple bladder TB. Renal TB. Ninth one, Alport syndrome.
Okay.
Eighth one, xanthogranulomatosis pyelonephritis.
Okay.
Seventh one, cystine stone.
Okay.
Seven point. .35 to 7.45, fourth one.
Okay.
Nail patella syndrome, fifth one.
Okay.
Sixth one, true.
Okay.
10th one, the first one. 10th one, true.
Okay, time's up. Answer slide, Ravi. The first one is ACE inhibitor which shows triphasic elimination kinetic is Ramipil, and the second one, Brodels line, is correct. Third one, Timble cystitis, Timble bladder seen in tubercular cystitis. You said right. And fourth one is correct. Fifth one is also correct. Nail patella syndrome. Sixth one is false. In earlier stage of CKD, it will be non-anion gap metabolic acidosis. Later stage will be anion gap acidosis. You said wrong. It's false. And seventh one is correct. Cystine stones. Eighth one is xanthogranulomatosis pyelonephritis. You said correct. Ninth one, Alport, correct. 10th one is false. You said true. I cells have more mitochondria than P cells. So you answered 1, 2, 3, 4, 5, 6, 7. 7 questions correct. So you get 70 marks. Okay. Okay. Team 3, which set you want?
Gmail.
Gmail. Okay, Gmail. Okay.
Conivapan B2.
Okay.
Treatment of hemorrhagic cystitis, Mesna.
Okay.
Potassium ion concentration is 3.5 to 5.
Okay.
Cobra head is Erythrosil.
Okay.
Spike and mutation in gene coding. Question number 6 is false.
Okay.
Spike endomembranous nephropathy. Okay. Sir, membranous glomerulonephritis.
Okay.
Question number 10 is true. Sympathetic supply for ureter. Passive bladder pressure exceeds. Claudin 16 familial hypomagnesemia.
Time's up. Okay, move to the answer slides. The conifaptone acts on which receptor? It is V1A and V2 receptor antagonist. So you said V2 alone. We are not giving mark for that. And for sympathetic supply of urator, it's T12 to L1. And third one, Mesna, you said right. Fourth one is also correct, 3.5 to 5.5. And fifth question, you didn't answer. You answered after timer, but we are not giving mark for that. Sixth one is false, correct. Seventh one is erythrocyl, you said right. Eighth one is stress urinary incontinence, you didn't answer. Ninth one, first you answered it as membranous nephropathy. Then you answered as membranous glomerulonephritis. Like Praveen, idukku mark tharalama vedama? Hello.
We can give for that.
Okay. 10th one is false. You said true. So you answered 5 questions you answered. You get 50 marks.
Hello.
Yes.
We said familial hypomagnesemia within the time itself. Like I answered.
Actually, it is an automated timer. It went to the next blank slide, and then you started with familial hypomagnesemia. Even then, you didn't tell hypercalciuria and nephrocalcinosis.
Okay.
So no.
So we can't give. Okay. Praveen, hyperlinks.
Yeah, second team.
We choose Twitter.
Twitter, okay.
Okay. Okay. The first one is ethaclinic acid. Anterior layer of false capsule of kidney. Sorry, type of status in serious fitting organism. Phosphate upload the serum creatinine. Mutation in CLCKNB is type 3 barter. Solute removal, hemolysis, concentration gradient, fluid removal, transfer. Sixth one is true. Market is 2 hour cardiopulmonary bypass. Creatinine on this 0.7 to 1.3 milliequivalent. Wire loop lesion type 4 SLE, lupus nephritis. Biomarker detected in urine within 2 hours of cardiopulmonary bypass associated AKI. Cardiopulmonary bypass associated AKI. LGALA. Okay. Where என்ன இருக்கு? Type of status urosplenic organism. Anterior layer of என்னது obese patients வந்து இதுதானே lithotripsy இதுதானே. Okay.
Time is up.
Can I consider 8th question as you answered or not? Praveen, previous slide. 8th question.
Hello, Yengal I told no.
Yeah. We are considering. We are considering 8th question. Okay. Fine.
Okay. Answer slide. So the first one is correct, ethaclinic acid. Second one, the anterior layer of false capsule of kidney is fascia of Taltz. And third one is alkaline encrusted cystitis. Fourth one, serum creatinine level 0.7 to 1.2 milliequivalents per liter. It's correct. Fifth one is Bardet syndrome, correct. Sixth one is true. Seventh one is PCNL, percutaneous nephrolithotomy. And eighth one is NGAL, you said correct. Ninth one, lupus nephritis, correct. 10th one is false. You didn't answer that. You answered first, 4th, 5th, 6th, 8th, and 9th. So totally 60 marks. Okay. Team 1.
Yeah, ready.
You have to. Okay. Time starts now.
First is amyloride.
Okay.
वो थर्ड वाला है वो तो केमिल्सिन विल्सिन से अरमानी एब्स्टन वही है ना थर्ड वाला. 9th is PSGN.
Okay.
Fourth is 135 to 145 milliequivalents per liter.
Okay.
Third is Arbani-Epstein lesions.
Okay.
Structure, अरे वो वाला है ना, अरे वो most sensitive ना, हाँ हो सकता है. Seventh is CT scan. Fifth is Liddle syndrome. Liddle, सुनो वो स्ट्रक्चर वाला वो है ना, यूरेथ्रल क्रेस्ट वाला, क्या नाम था वो यार, जिसपे सेकंड वेरुमेंटाइनम ना, हाँ नहीं, बट वेरुमेंटाइनम ओरिफिस है उसका स्ट्रक्चर. ठीक है. Tenth is false.
Okay.
Sixth is false.
Okay, time's up.
वेरुमेंटाइनम बोल देना.
Okay, time's up. Hello. Answer slides. First one, Melo, right? You said correct. Second one is the structure which extends from urethric orifice to urethral orifice is bars of well, a bar of wells. Third one is Arbani-Epstein lesion, correct. Fourth one, 135 to 145 milliequivalents per liter is correct. Fifth one is recessive pseudohypoaldosteronism type 1. Like you said, Liddle, right? It does not, that not be a mutation in alpha subunit. Here there will be mutation in alpha, beta, and gamma subunit. And sixth one you said correct, false. Seventh one, non-contrast CT, but you said CT, I'll give mark. Eighth one is neurogenic bladder, severe neurogenic bladder with detrusor sphincter dysnergia due to lesion above S2 to S4. And ninth one you said RPGN, correct. 10th one you said false, correct. You answered first, third, fourth, sixth,
They said
seventh.
9th one PSGN, right?
Yeah, so PSGN is also right, ना, star इसका है.
PSGN shows Stariska due to IgG, IgM, C3.
I think we should give, we can give.
Yeah. Okay. I'll give to you. First, third, fourth, sixth, seventh, ninth, 10th. You answered 7 questions correct, 70 marks. Okay.
That will be the end of this round.
End
There
of-
is only 9 minutes left in the meeting, so we'll have to rejoin.
We'll have the scores before that.
Wait. We'll have the scores. Yeah, Karthik.
Yes. So at the end of the rapid fire round, team 1 has a score of 325.
Oh, fine. Team 3. Yes, team 3 has message. Okay, fine. Excellent.
We
We'll
can
start.
start
We'll go ahead. I believe. Yeah, team 2 chose 2. Tyrion Lannister.
Okay.
2, right? Tyrion Lannister.
Team
Yes,
2,
yes.
Are you there?
Team 2.
Yes.
Okay.
Second picture.
Yeah, okay.
Yeah, this drug is approved by the US FDA for treating adult and pediatric patients with a post-transplant CMV infection that does not respond to antiviral treatment of CMV. It works by preventing the activity of human CMV enzyme PUL97. So it blocks the virus replication. What is the drug?
Pound starts.
Yeah, pound starts.
Backup, please inform when the bounce is ended.
Counts over.
Bounce is closed. Team 1,
team
3,
2.
4, and 6. Sorry.
Okay.
Whether you can say the direct answer.
Yes, you can tell the direct.
Wait.
Hello, we have also found
Okay.
this.
Okay,
Can you
fine.
check?
Yeah, okay. Fine. Who have all bounced?
Mari. We can tell the answer. Sultan.
Solta. Sudhir. Hello, Sudhir.
Yes.
Who have all bounced?
1, 3, 4, and 6.
They have bounced. What is the team 2? Have you given given your answer? Right.
Yes, Maribavir.
Okay, fine. What are the bounce answers?
The bounce answers, 3 teams have given it right.
Okay.
1, 6, 3, and 4. Yeah, all the 14 children. That's Maribavir. Yeah.
Okay, fine.
Okay. Shall we go to the diagnostic question?
Yes.
Next slide. Name the diagnostic procedure shown here and the pathology and the treatment for this.
Bounce time starts.
Bounce starts.
Counts over.
Bounce closed. None of the teams have bounced. We can go with the direct answer.
Okay, team 2, please can you answer? Do you have an answer? Team 2?
Hello. Hey,
team 2.
Yes. It's whether it's Lerici syndrome. Treatment is aortofemoral bypass. Then pathology. What like stenosis, like aortoiliac cells or stenosis.
What is the diagnostic?
Diagnostic procedure is CT renal angiogram.
Yeah, you are correct. Next slide, please. Answer slide. The drug is Maribavir and the pathology is Lerici syndrome. Okay, we'll go to the next question. Hyperlink.
So 1, 3. So team 1, 3, 4, and 6 have answered right on bounce. Team 2 has answered their direct question. Both the direct questions correctly. Is that correct, Hemant?
Yeah, both questions you have answered correctly. Team 2.
Okay.
So that's a diagnostic part. No team has bounced, right?
Yeah, no team has bounced, so the diagnostic part.
Okay, fine.
Okay.
Team.
Next question.
Team 3, choose your hyperlink, please.
Sansa Stark.
Okay, Sansa Stark. This is a drug, which is a C5a inhibitor indicated for adjunct therapy for adult patients with severe ANCA-positive vasculitis, like granulomatosis with polyangiitis and microscopic polyangiitis. It is in combination with glucocorticoids, but it does not eliminate the use of glucocorticoids. It was approved in 2021. So, what is the drug? C5a inhibitor.
Bounce time starts.
Counts over.
Count stops. Counts close. I believe we can go with the direct answer. Team 3.
Team 3.
Can we answer? Hello?
Yes, you can answer, Team 3.
Avacopan?
The correct answer. Can we go with the diagnostic question?
Once again,
Okay.
Team 1, 4, 1, 2, 4 and 6 have bounced. 1, 2, 4 have answered Avacopan, correct. 6 has answered as Stabneos. So 1, 2, 4 get their bounce.
Shall I move to the next part?
Yeah.
Did we also get the point for that? Because Stabneos is the.
Isn't it the training?
No, we can't. Like Avacopan is the name. We can't give for any other names. Fine. I'll go for the diagnostics part.
Identify the investigation and the pathology shown here. Name the markings G and P.
Count
starts now. Yeah.
Counts over.
Count stops.
PNPs.
Team 6 will go with the answer.
What? Huh?
What is the answer?
Counts 4.
Can we answer Team 3?
Count is over, yeah.
You can answer.
Yeah, you can answer.
Team.
Investigation CT abdo.
Okay.
Pathology. I don't know what it is. I don't know about this.
Team 3, are you answering?
Yeah, we don't know.
Okay. So Team 3 has scored only.
Team 6 is found angiomyolipoma, muscle and fat, but I believe they have not told what is G. Like they have not mentioned what G and P are. Move on to the answer side, I guess.
Answer side.
What's the answer actually? Is the pathology right now? Yes.
The drug was Avacopan. The modality is CECT abdomen showing emphysematous pyelonephritis. You can see the gas shadows in the kidney. G and P are G is gerontospacia and P is perirenal space, which was enhanced due to inflammatory involvement.
Yeah, so I believe -20 for Team 6. And are we reducing the marks for Tabneos because that seems to be the trade name, but should we give negative points for the bounce? Hemant and Praveen.
Hemant's decision.
So please consider it. At least don't give negative marks.
Hemant, your call.
Brand name is okay.
Okay, no negatives then. No negatives. That's it.
Okay, no negatives.
I just have a doubt for the second part. Usually there are 3 sub questions. So if the pounds we answer 2 right and something, so what will be the marking?
The end. Hemant, I think you can explain this much better.
What?
No, for pounds you should give the entire answer, or else no. If you are
No, so we'll
pouncing, you
get
should give the
like
entire
answer
answer.
2 correct and 1 we leave it. So we get negative or we get 0.
You will get 0. You will get 0 if you answer that way.
Team 4, choose your hyperlink.
Yeah, Jon Snow.
Jon Snow.
I will can move on to the next question. Team 4.
Yeah, they have chosen Jon
Scorer,
Snow.
is it all clear? Start again.
Clear, sir. Clear, sir. For minus 20 for the diagnosis part.
Yes, for team 6 here.
Yeah, no other points for any teams.
Yeah. Jon Snow?
Yeah, Jon Snow.
Team 4. Taking Jon
Team
Snow.
4.
Jon Snow. Okay.
Drug question for Team 4. On 2021, FDA approved this drug, which is a HIF inhibitor for adult patients with VHL associated disease who require therapy for RCC, CNS hemangioblastima, and peanut tumors, not requiring immediate surgery. What is the drug being discussed? For Team 4, pounds is open.
Pounds can start.
Sounds over.
Pounds is over. Team 4, you can tell your answer.
Team 4 can say.
Belzutifan.
Once more, please.
Yeah, Belzutifan.
It's okay.
Team
correct.
1, 2, 3, and 6 of pounds. They have answered Belzutifan. Yeah. I got the answer.
Next question.
Yeah.
Diagnostic question. Question for Team 4. A 14-year boy with sudden onset seizures and oral fibroma showed the appearance in the radiograph. Pounds is open.
Pounds starts.
Sounds over.
Pounds is closed. No one has pounced.
Okay, Team 4, can you answer?
Yeah, this is contrast returns MRI. Abdomen.
Okay. What is the pathology?
Is this Fabry's disease?
You're wrong. Okay, can we go to the answers? Answers like it was T1 weighted MRI showing renal angiomyolipoma. History with seizures and oral fibromas, mostly tuberous sclerosis.
Okay. I think team 1, 2, 3, and 6, along with team 4, get plus 40. And team 5, sorry.
Team 5 can
The
choose
first
your
one. The first one.
Arya Star.
என்னது team 5 is
Arya Stark.
okay.
Arya Stark.
This drug is a calcineurin inhibitor used as an immunosuppressant. It was approved by the US FDA in 2021. It was initially a mixture of cis and trans geometric isomers. Later, in collaboration with Roche in Basel, Switzerland, the drug manufacturing was changed so that it was predominantly a trans isomer which was used with the beneficial effect of immunosuppression and organ transplantation. Used in the treatment of organ transplantation and autoimmune disease, which is the drug.
Phone stats.
Pounds over.
Phones is closed. Teams 1, 2, 3, and 6 have bounced.
Can I give my answer?
Yeah, you can
Hello?
give your answer.
Go close for it.
It's the correct answer. Okay.
Yeah,
Go to the next question.
Yeah, okay, one second. Okay, all of them have answered.
Okay,
except for team 2.
Team 5.
They've given their answer as anifrolumab. This is the wrong answer. So, yeah.
Team, sir.
So 1, 4, and 6 have given the right answer. 4 plus 4. And team 2 has given anifrolumab. This is wrong.
Can I go to the next slide?
Okay. Next slide. Team 5. Describe the radiograph finding and name the criteria for the pathology.
Pound starts.
Pound starts.
Pounds over.
Phones is closed. Team 2 has points. The direct team.
Hello, can I answer? Hello.
Okay.
Yeah, there are multiple cysts, so probably it's autosomal dominant polycystic kidney disease, and for that, Pay-Ravin criteria, or you can just consider it as a cyst and go for Bosnia classification.
No, you're wrong. Actually, not ADPKD. Can we go to the answers? It was actually hydronephrosis, renal hydronephrosis, and the grading was the procedure was USG abdomen showing hydronephrosis, and the grading was 1 grading for hydronephrosis. Drug is O+4.
Can I have the spelling, please?
ONEN.
Team 2 is pounds and pounds. They said ARP case with O'Kindon's grading. I don't think. So minus 20. Team 2 minus 20.
Where the team bounce பண்ணிருக்கா?
No one else.
So for the tuberous sclerosis question, can I get the points for the diagnosis part on the set க்கு மட்டும்?
1 second. Tuberous sclerosis, I think, yeah, okay, only team 6 is found. They answered as, not that. Tuberous sclerosis, I don't think anybody pounds, right? Yeah.
Okay, fine. Nobody pounced, right?
Nobody pounds. Nobody.
Okay, thank you.
So team 6, you have the last option of Cersei.
That last one. The sixth.
Last question. Hello. Yeah. This drug is a selective peripheral kappa opioid receptor antagonist indicated for treatment of moderate to severe pruritus associated with CKD in adults undergoing hemodialysis. It was approved by the US FDA in 2021. What is the drug being?
Pound stats?
Pound stats.
Pounds close. Team 1, 2, 3, 3, 4, and 5. Yeah, all of them. We'll go to team 6 who can answer the question directly. Team 6?
Sure. Yeah. The answer is diflacyfelin.
Can you repeat, please?
Okay.
Diflacyfelin.
Okay.
DIFE.
Diflacyfelin.
LIKEFALIN.
Okay, you're correct. Next question. Name the investigation shown here and the pathology and its etiology.
Pound stats?
Pounds over.
Pounds over, known as pounds for the diagnostics question.
Hello. Is this staghorn renal calculus? And
Just a second. Team 1 has pounds. Can you just see R Sudhir? Much before
Team 1
you
has
said
pounds.
pounds.
I believe when she told known as pounds, I didn't really
Before
remember.
10 seconds before that, I paused. Just check the time. Like I gave the answer in 4 to 5 seconds.
Yeah.
Fine.
Okay.
Fine, I'll take it then.
Team 6, you have,
Team 1 and 5.
you gave the wrong answer actually.
Can you go to the answer slide?
Staghorn calculus.
No, it's wrong. It is IVP showing papillary necrosis, renal papillary necrosis, abnormal calyces, and its filling defects can be due to sickle cell anemia, TB, or diabetes.
Team 1 has answered IVP, Staghorn colliculi, and Proteus. And Team 5 has pounced and answered lobster claw for papillary necrosis. I believe both are partial answers. So, no negative marks. That is all you can say.
Yeah,
Correct,
fine. Fine,
yeah.
no negative.
And and for the
1
first
minute.
question, everybody has pounced and every
First question, like
diphenylkephalin,
diphenylkephalin, whether pounds results you announced?
No, I didn't announce. I'm saying it now. Plus 40 for everyone. Can you hear?
Plus 40 for everyone now. Hello.
All of them bounced properly. Yes. All of them are bounced and all of them are answered it properly. Hello. Hello guys, can you hear me?
Yeah, you're audible. That's it. That is the end of this
Next
round.
round. We'll go to the next round.
Yeah, that is there is only one more round, last round connection. So if we could have the scores right now.
Sir, Sudhir sir, for the diagnostic question, does the sixth team get any marks?
No.
No marks. Fine. Yeah, just a minute. I am up to the scores.
Okay. How many minutes are left in the meeting, Praveen?
6 minutes more. I thought we could just end with the scores and go for the last round.
Yes, you will do that.
Yeah, we'll go with the scores now. At the end of this diagnosis and drug round, we have the scores with team 1 565 points, team 2 560 points, team 3 480 points, team 4 370 points, team 5 185 points, and team 6 4.
We'll sort it
Sure.
out at the end. We'll
Sure,
continue with this round.
Hello guys, now we are on to the final round, connections. Hello, am I audible?
Yeah, you're audible.
Rules slide please.
Can you be a little bit louder?
Rules slide please.
Yeah.
Okay, so we have 6 questions. Pounds is open for all the questions. The team to which the question is directed will get 60 seconds to answer. And for pounds, you have 20 seconds. For a direct question, it is plus 40 and no negatives. So there's a change in the scoring there. And for a pounds question, it will be plus 40 and minus 20 for wrong answer. And one team can give only one answer. And no marks will be given for partial answers. I want the complete answer if you want any points. Yeah, that's it. Any questions?
Who do we pounds to? That's Sudhir same.
Sorry?
The person who we pounds send direct message for pounds. Sudhir only.
Yes, we'll be messaging. Sudhir, yeah.
Who to send the pounds answers to?
You'll be sending it to me, Sudhir.
Just a second. They should send only the final answer, right? They don't need to explain anything, right?
No, only the final answer.
Yeah, okay, fine.
Okay, so shall we start? The hyperlink slide, please. We'll start from team 1.
Hello, yeah. The fifth image, 13.
Your time starts now.
So bounce over, Alaka. Bounce is close.
Okay, so bounce is closed. Team number 1, you have an answer.
We have got 40 seconds, right?
You have 60 seconds on the hold. So after bounce, you have
Okay.
40 seconds.
हाइपर पैरा नहीं लग रहा है, नहीं लग रहा है. Can you answer?
Yes, you can.
Is it renal tubular acidosis?
I need you to be a bit more specific. I want the complete answer.
Okay, you want the type?
Yes.
Okay, type 1 RTA.
Okay. Answers right, please.
Just a moment.
Hello, we can't hear.
Hello.
What
Team
happened?
2, Team 6. Okay, so Team 2, Team 6, and Team 5 have bounced.
Okay.
Team 5 has answered. Team 5 and 6 have answered type 1 RTA. Team 2 has answered Fankani.
Okay. The answer is type 1 RTA. Please show the answers, right? So the first picture was metabolic acidosis. The second was muscle weakness due to hypokalemia. Third was renal stones, and the fourth was rickets. The answer is distal renal tubular acidosis.
Shivanga, I think you can be a bit louder. Team 5 and 6 get it right on bounce.
Okay. So back to the hyperlink.
Team 1 you gave marks, right?
Yes. Team 5 and 6 get it right on
Team
bounce.
1, 5 and 6 have got plus 40 and team 2 has got minus 20. Is this clear?
Yes.
For this question. Yes, thank you.
Team 2, please choose your hyperlink.
Third picture.
Your time starts now. Guys, bounce is over.
Bounce closed.
Okay, we can answer.
Yes, you can answer.
It shows the answer is multiple myeloma. It shows scrap futures, and the last picture shows a fractured cast in light chain cast nephropathy.
Okay. Yes, that is the right answer. What were the bounce answers?
No one has bounced.
Okay. Please show the answer slide. So the answer was light chain cast nephropathy.
So plus 40 for team 2. Is that right?
Yes.
Karthik, please.
Yes, sir.
Team
Noted.
3, please choose your hyperlink.
Foreman.
The time starts now.
Bounce starts, yeah. Pounds closed. Team 1 and Team 2 have bounced. We'll go for the answer from.
Lithium-induced nephrogenic diabetes insipidus.
That is the wrong answer.
Okay.
Can we have the answer slide, please? So that was lead nephropathy, Catenin gout, hypertension, renal insufficiency, and lead batteries.
Team 1 has answered lithium nephropathy and Team 2 has answered cadmium toxicity, both of which are wrong. So minus 20 for Team 1 and 2.
Okay. Hyperlinks.
Team 1 and 2 minus 20.
Team 4.
House.
Your time starts now.
Pounds closes. Team 2, I'm not taking your pounds answer. So Team 1, 3, 5 and 6 have pounds.
Team 4, do you have an answer?
Yeah, scleroderma renal crisis.
I'm sorry, can you repeat that?
Scleroderma renal crisis.
Yeah, that is correct. Answer slide, please. So what were the pounds answers?
Teams 1, 5 and 6 have answered scleroderma renal crisis. Team 3 has answered systemic sclerosis.
Team 2
and Team 2
has also answered.
No, but you have answered after the bounce time was over.
Like
I was checking. I'm sorry.
Like there was connectivity issues. No, it came after. Sir, just after. No, can consider.
Praveen and Shivaganga, your guys call. It did come just after a second.
It is just after a second. Might be due to connectivity issues.
We can consider it being an online quiz.
Have they been given or not?
Are we considering it?
Yeah, we'll consider. Have they given the correct answer?
So you give your answer systemic sclerosis.
Then okay, we'll consider. Okay, we'll consider.
Excuse me. We are considering systemic sclerosis, right?
Yes, it is considered.
So all
I
teams
think
get
it should
a
not
plus
be
point for this
considered
question.
because systemic sclerosis will have this particular manifestation, this particular complication, which has to be specified, I think.
Yes, and you mentioned that very specific answers. You asked us RTA type also.
Answer. I wanted sclerodermal
Yeah.
crisis.
So how is systemic sclerosis being considered?
The systemic sclerosis is a big entity. I think it is one complication. It is just a part of that. I think it should be specific.
Yeah, even in RTA also you asked us to specify whether distal or proximal.
Definitely. Okay, fine.
One more thing.
But Rodman grading and all is for systemic sclerosis only. No, it's not specific to renal. So.
All the findings that will combine to form the diagnosis of systemic systemic sclerosis, scleroderma renal crisis.
Even the
everything
antibody was.
Yeah, anti-U3 RNP is also specific for that.
Guys, I think as soon as you look at the antibody, you can say it's systemic sclerosis, but we expected renal crisis specifically.
But antibody.
And one more thing is internet issues is we cannot take that into consideration. So only within the time if you send, we can consider for answer. Sorry.
Are we considering or not systemic sclerosis then? I mean, there has been so much leeway throughout the quiz.
No, we'll be considering only sclerodermal renal crisis.
Okay, then. Good.
The point split up, please. So there's a the point split up.
Team 1, 5 and 6 have answered scleroderma renal crisis. They'll get plus 40. And team 3 has answered systemic sclerosis. And team 2 has answered beyond the time. So we are not considering that. Yeah.
Yeah. So do any team have a negative score?
Since it is systemic sclerosis, I guess it's a partially right answer, but are we giving negatives for that?
At least don't get negatives because so many teams asked for it and you guys were like, it's okay.
Yeah, I think
Sorry,
we'll
fine.
give 0 for that. 0 for
We'll
systemic
give 0.
sclerosis.
So no scores for team 2 and 3. The other teams get plus 40.
Yes.
Okay.
True.
Team 5.
The third one.
Third one is already taken in.
Has already been
Oh, which ones are remaining then?
Second one is there, and last.
Second and fifth are remaining. So
Second
second
and
and
fifth,
sixth. Second and last.
Second and sixth. We'll go with the second one then.
Your time starts.
Phone stops. Team 1, 3 and 4 are bounced.
Okay, team 5, answer. Team 5, do you have an answer?
We don't have an answer.
Okay. What are the bounce answers?
Team 1 has answered Eagle Barrett, Vacuolar Prone Belly, and team 3 and 4 have answered Eagle Barrett and Prone Belly. Can we go to the answer slide?
That is correct. So I think all the bounce teams get it correct.
So team 1, 3 and 4 get plus 40, right?
1. Yes.
Okay, now we have the last question. Team 6.
Yeah, whatever is remaining, I guess. Okay.
Time starts now.
Round starts. Phone stops.
Yeah, can we see the answer? Yeah, it's Dragon calculus due to Proteus.
Okay.
Thank you very
Yes,
much.
the answer is correct. What were the answers?
Team 2, 3, 4, and 5 have bounced. They've answered Stragon calculus. It's 2 white stones.
So only team 1 hasn't bounced, right? All the other teams have bounced.
Yes, only one has not bounced. Yeah.
Okay, so we have come to the end of this.
Sorry?
We are done with the round. We have come to the end of the round.
Yes.
Yeah, that's it. We've come to the end of the quiz. If you can.
I'm really sorry to disturb, but can we please rectify the rounds?
Yeah. Can we please have the scores and whatever doubt they have in the previous round?
Thank you so much.
Yes, so we are back to the scores now. And team 6, when we were going through the YouTube live, we found that we had missed giving that 40 points for the fourth question for you. So we'll be adding that 40 points. So before the start of this round, instead of 460, you will be starting with 500. So we'll go with the score. After adding the scores of this round, we have the final scores as follows. So the team 1 scored 665 points. Team 2 has 600 points. Team 3 has 560 points. Team 4 has 490 points. Team 5 has 305 points. And Team 6 has 620 points. Are there any clarifications in this score?
Team 2, it's not 600. Like we answered like the last
Yeah,
round,
you
like
answered
before
two
last
questions.
round. Before last round itself, we got 560.
Yes, sir.
Then
you got 2 negatives, so 2 minus 20s and 2 positives, 2 plus 40s.
Which one negatives? Can you say?
First question and third questions are negative.
First question, like answer type 2 or TA, then.
Yeah, and
third question is.
Third question.
Okay, let that.
Yeah,
Okay.
So, render negatives, sir, and 2 plus 40s.
Okay,
Yes.
fine. No problem.
Any other team has any clarifications? So, we'll go on to the final placings for the teams. So, in the 6th place is Team 5 from MMC with 305 points. In the 6th place, sorry. And in the 5th place, we have Team ESIC with 490 points. In the 4th place, we have Team JIPMER with 560 points. And in the 3rd place, we have Team 2, also a team from JIPMER with 600 points. In the 2nd place is Team 6 with 620 points. And with the 1st place and winning this quiz is Team 1 from Madras Medical College, 665 points. So are we clear with this?
Yeah, congratulations, guys. Yeah.
Congratulations, everyone. Thank you. Thank you for attending the quiz.
Adharsh, sir. Okay.
And we all hope to meet you. Yeah, we all hope to meet you at Chennai for our
Congratulations, guys. Thank you so much for staying till the end. I hope you guys got to learn at least
Yeah, we learned a
few
lot. It was
things
nice.
new
This was
today.
really nice.
Yeah, and
பயங்கரமா
this
போச்சு
is
வணக்கம்
just
கூட.
this is just an insight into
This is
what
just a
Genesis
prelude to what
actually
is
has
going
in
to
store
happen.
for you. So we hope to see most of you, if not all, in our main event.
Yeah. Yep. So thank you guys. We all hope to see you at Genesis during October 21 and 22. Yeah. We'll be connected.